We know that dealing with insecurity and loneliness takes a tremendous toll on a person's emotional well-being, but our next guest has found there are harmful physical side effects as well. Jean-Philippe Gouin, Associate Professor of Psychology at Concordia University, joins us now to explain. Professor, thank you for being here. Let's jump right in. Your study followed 58 international students within the first 3 weeks of their arrival in Montreal. Tell us what you found.
So we found that over time, there was, as we expected, the change in social integration, but there was significant individual differences. So some of these new international students were good at making friends and integrating social networks. And in turn, that change in social integration related to change in C-reactive protein, which is the marker of systemic inflammation. Systemic inflammation is an immune system, component of the immune system that is very important when you fight a virus or an injury, for example. But when we have chronic elevated level of inflammation, that's associated with increased risk for chronic diseases.
Now, we're all familiar with the term dying of loneliness. Talk to me about what are the potential physical impacts of not having friendships or a robust social network?
So what we see is that over the long run, these people are at greater risk for developing cardiovascular diseases such as hypertension, coronary artery disease, or even stroke. We know from epidemiological studies that people that are lonely tend to die earlier.
Wow, the implications are quite deep. Did the lack of having attachments or others affect people differently if they were in good health or in poor health? Did you look at it through that lens?
No, actually, for this study, we selected only the healthiest international students because we were interested in seeing, even among the very healthy, can we see an effect on their social relationship? Because then we think that among people who are already in poor health, the effect would be more pronounced.
Well, I think a lot of people listening to us this morning would say, all right, this is very interesting, but what's the next step in your research?
So what we see is that there was a key significant individual differences that allowed us to predict who would be more susceptible to these changes in inflammation. This was what we call attachment anxiety. Attachment anxiety is your general propensity to, when you meet someone else, to have an automatic evaluation. Can I trust this person? Can I open up to them? And people that tend to fear rejection or abandonment were the one which would show the greatest increases in C-reactive protein over time.
All right.
So what this means is that we can...
No, keep going, sir.
Yes. What this means is that we can identify people that tend to be even more susceptible to this lack of social relationships.
Well, we appreciate your time today. Thank you, Jean-Philippe Gouin. Keep up the good work.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.